afternoon. Let me welcome the Special Envoy of the Secretary General on Ebola, David Nabarro, and WHO's Special Representative on the Ebola response, Mr. Bruce Aylward, and they'll say a few words and then take your questions, Mr. Nabarro.
So thank you very much indeed. It's really very good to be back with you, and really lovely to be here meeting with people who have been following this outbreak so closely. We're really pleased to be back. We want to make sure that you're updated on the response. And just in a nutshell, good progress is being made, but the outbreak still presents a grave threat, and we really hope that there will be no complacency among anybody involved in the response. We have to really work hard to get to what we call zero cases and zero transmission. Now, you'll have seen from the WHO situation report that there has been an increase in the number of cases reported in the past week. If we look at the data week by week, in the last week, 124 confirmed cases were reported. That's 25 more cases than the previous week. And I think what this reminds us is that in a situation like this, there will always be volatility. Numbers will go up and down, but the more we're able to actively seek out cases and follow up their contacts, the better our results will be. And the quicker we can say to each other, yes, this outbreak is under control. It's not yet. I'd just like to say a word or two about the response so far. The international community has been incredibly generous, whether it's individuals, or governments, non-governmental organizations, businesses. We've seen real generosity, but perhaps the heroes have been and will continue to be the communities, the people, the health workers from the most affected countries, Guinea, Liberia and Sierra Leone. Now, to finish the work off, it will be necessary to continue to bring in materials and people so that we can undertake the kind of detective work that is necessary in an area that's bigger than the United Kingdom, almost as big as France. And so one of the things that we've done is to appeal for more resources. The latest overview of needs and requirements for the Ebola response was launched at the World Economic Forum last month, and it asked for $1 billion worth of funding for the United Nations. And the idea is that this financing will support the efforts of the governments of Guinea, Liberia and Sierra Leone and their people to overcome the disease, and also at the same time to get basic services back and working again. Now, some of you will have seen that there were reports about slow disbursement of funding in the affected countries. Actually, that wasn't what I've seen in my 6 visits in the region. And during the period October to December last year, more than $850 million were spent, and indeed, more than 75% of the amount requested last year was pledged or committed by the end of the year. But it was difficult to implement the response in some places. We had to find people, we had to establish new ways of working, because we haven't really had to respond to an outbreak of this size or complexity ever before. But we have seen the construction of 2,000 Ebola treatment beds. We've seen the establishment of 255 burial teams to do safe and dignified burials, the employment of more than 11,800 contact tracers to identify contacts. During that time, it really is a massive response. And we have to continue the hard work until the last person with Ebola is under treatment, and then the outbreak is finished. It's painstaking, it's difficult, but we're determined to complete the job. Now, my colleague Bruce Aylward, who everybody knows, is going to provide a little bit more colour, and then we're going to take some questions. Bruce.
Thanks, David, and good afternoon, everyone. I think we're here to answer questions as much as disperse information. But maybe a couple of points to put in context the importance of the financing gap that David has spoken to, and the situation we're in terms of the multi-partner trust fund, as well as the financing of the agencies involved. I've talked to you a number of times in the briefings as I've come back about and warned people that we've had this decline in cases, and the biggest problem that we have right now is people thinking that this is going to continue and it's going to drive it straight to zero. And I've been warning that that's not what's going to happen. It's going to decline to a point where we are going to come right up against those factors that are going to make the end of Ebola extremely difficult, extremely risky. And we've hit that point. That's the message today. And if we were to look at, I have a graphic here of just what's happened since the beginning of this year. You know, here is the decline in cases that we've been seeing. Here it started to flatten a couple of weeks ago. Last week it started to flatten a little bit again, and we've just had a bit of an uptick again this week. Many people would be dismissive almost of a small uptick like that on a graphic like this, but the reality is what it reflects is we have hit those communities that are still inaccessible to the program. We have hit that challenge of long-distance movement of the virus in these countries and the continued movement of it. And we've hit a number of other barriers, one of the increasingly important ones being a financial barrier to rapidly adjust strategy and get the kind of platforms we need out there in some of the highest risk areas. So if you look at some of the numbers behind this, you remember, I think the first time I spoke to you was in late September. At that time, we had about 800 cases a week, and the doubling time of the virus was every 2 to 3 weeks, or in terms of the number of cases, not the virus, excuse me. And then in the 4 to 6 weeks that we've just passed, you have seen the halving time of the virus, of the cases every 2 to 3 weeks. So there was a sense that it went up like this and it will go down like that. But again, as David mentioned, we went from 99 cases last week to 124 cases this week. And those increases in cases were in Guinea, where we went from 30 cases last week to 39 this week. Occurred also in Sierra Leone, where we went from 65 cases to 80 cases this week. In addition, the geography became a little bit more challenging. Again, another important reminder for us of the challenges in front of us. Last week, we saw a virus go, or pardon me, a person go with a virus in them from Monrovia all the way to the prefecture of Palais, way over on the other side of Guinea, right across Sierra Leone up to that corner of Guinea. This week, we have seen virus in Sigiri, which is right up on the border with Mali. That virus came from Lola in the southern part. You know what? I actually have a map, and I will show you where some of these movements were. So what we saw this past week was, last week we talked about the virus from Monrovia that traveled, thanks David, that traveled from here all the way up, right across Sierra Leone, we believe, up to Malé, right up on the border of Senegal. Then we saw virus this week go from Lola County, or sorry, prefecture, way down here in the corner of Guinea, right up here to the border area again with Mali, to an area called Sigiri. And then we've just seen virus now from over here by Bakongo go all the way up to this area called Tugay, up on the Senegalese-Mali border. So not only are we seeing slight increases in the virus, but we're also seeing these long-distance movements, which, of course, are such a challenge. The other piece that's complicated it over the last couple of weeks, again, especially in this past week, where we've seen the flares and what's been driving a lot of that increase in cases, right here in Forakaya on the border with Sierra Leone, this was a community where there's been a lot of challenges getting them to accept and fully engage in the program. A flare, 8 additional cases there this week. Right across the border in Sierra Leone, in Cambia, another flare driven by the same underlying challenges of engaging with the community and getting the behavior changes needed, and the same story repeating itself in other places. So, you know, this brings us really to the context for the works David's doing on trying to get the financing and the appreciation of the importance of the financing gap right now. The virus has told us this week, loud and clear, I am not going to go away the way you're expecting me to based on these curves. And all I have to do is survive out the next couple of weeks till the rains hit, or next couple of months, and then you're going to have a very, very difficult situation. Right now, our ability to fully exploit the window we have between today and the onset of the rains in April, May is constrained by financing. There's absolutely no question about it. We've put large armies of people, sorry, poor choice of words, large numbers of epidemiologists and others out into the field. Every single district now, we are trying to get them fully capacitated to be able to optimize their work. And there's a number of other places where we are cutting corners at just the time you should not be cutting corners because of the challenges that David highlighted. So David, maybe I'll stop there because the main point really was about the message in that graphic right there. This is not what you want to see 2 months before you're going into the low season, as you are running into cash flow problems and as the virus is starting to move, again, substantive distances between these countries.
Thank you. Let's take your questions. We'll start with you, Lisa. Can you say to whom you're addressing the question?
To both of you, whoever wants to answer it. Actually, I have a few tiny questions, so there's plenty to go around. But I would like to, I had read that unsafe burials was possibly behind the uptick of cases in Sierra Leone. What is your take on that? And then, David, you mentioned you hope that people won't become complacent. I was wondering whether it's premature for schools in the 3 countries to reopen. They're all planning to do this. And I read an article about Liberia, which gave me a bit of the shivers in terms of people behaving as if there had never been an Ebola epidemic. They were shaking hands and hugging each other and gathering in crowds. Should they be doing that?
First of all, thanks again, Lisa, for coming in with questions that take us into the detail, but the right detail. When we're dealing with disease outbreaks, we come across all kinds. Some of them are carried around by water, some are taken by food, some are in the air, some are in the soil, some are transmitted through sex. This one is transmitted by body fluids, and the commonest way in which people are getting Ebola is through the rituals that take place when somebody is buried, particularly the important cleansing and touching that goes on that's absolutely necessary to ensure that the spirit of the departed person goes into the community and into the environment in a happy state. And people are really determined to do that properly because they fear that if they don't do so, that this will have a long-term effect on the well-being of the society. So it's not easy to persuade people to change burial practices, and I think we all appreciate that to ask them to do so is asking a lot of them. However, unless it is a change, if somebody is buried using the washing and touching technique, and they happen to have Ebola, we're afraid that it's going to lead to quite widespread distribution of the virus. And so the flares that we're seeing that Bruce described are usually because there's been an unsafe burial, probably done secretly because people increasingly realize that this is not appreciated as a way of behaving, and it has a really serious impact. So we continue to try to work with communities to help them to have the burials that they need to, without at the same time adopting practices that are going to lead to spread. And that is our main focus. We've had anthropologists helping us, we have local leaders helping us, but we've still got some way to go. Bruce will talk about that in a second. On the issue of opening of schools, I want to be clear that the schools have not been open for nearly a year now in many parts of the affected area, and it was causing quite a serious problem for the functioning of society. And there are quite large areas where the virus is not being transmitted intensively, so we're pleased to see the schools being opened, but we do want, as with most other activities, for it to be done safely, and that's why we've been working very hard with the governments, with the local communities, for safe school opening in a way that reduces the risks of these becoming places of transmission. But of course, everybody's really hoping and praying in many cases for the outbreak to finish so that they can get back to normal life. People touch. I mean, just as in every other society people touch, but here people touch a lot. And so they would like to be able to get back to full contact if at all possible. And our job is to say, hang on, please remain respectful of the fact that intensive contact is dangerous. Please continue to respect the reality that this virus actually has fun when we touch each other a lot, especially when we're sick. And so therefore, we are trying to ask that for the time being, people should refrain from all the stuff that we normally do. Bruce, do you want to talk a little bit about the burials? Because you've been looking at this and you've got the numbers.
Yeah, but I have the numbers, but as you mentioned, the numbers aren't complete. Right. So maybe a couple of words, though. Unsafe burials are one of a number of practices that are probably still driving the problem. That is probably the most difficult one to address, without a doubt, as David has highlighted. One of the challenges, of course, Lisa, you'd appreciate, people ask us, well, what is the percent of unsafe burials? Well, if they were not, if they're unsafe, it means that we weren't there. It means that we didn't see it. So our understanding of this is incomplete. And when you go back and you talk to people who confirm cases, and you try and understand their contact, what their contact was, you can usually only sort that out in about 50% of cases. Now, of those, about half of them are unsafe burials, and others are a mix of things. So it's probably the major driver among the ones we can define. I think as we get down to lower and lower numbers, it is again becoming an important, a more and more important issue. At the beginning, it was important in driving a lot of the transmission because people just didn't understand. As general awareness rose, it drove the numbers right down. And what we've been left with is that residual, I hate using words like hardcore, unsafe burial practice, but it is those areas that have been most resistant to changing it. One of the words we often use, and I used a number of times in talking about this, was the flares that often follow an unsafe burial or an unsafe event. And in some ways, that's a bad phrase, because a flare suggests it's going to sort of burn and then stop. And what we've seen is it burns and burns and burns unless we can really get to the root cause of this thing, as David highlighted. Now, the good side, the good thing, though, I've talked about some of the challenges and the alarms. We are seeing some real improvement in some really key indicators that we started talking about just a couple of weeks ago. And one of the ones we're really interested in is what % of new cases are coming from contact lists. Because when all all the cases come from contact lists, then we could almost say it's under control or it's manageable because we know where the transmission is. In Liberia this week, for the first time, they hit 100% of their cases came off a contact list, which is a really important indicator to have hit. Sustaining that is going to be a challenge, but it's a good, they've done a great job. In Guinea, they hit 54%, which was about a doubling of where they were this 1 week ago. And in Sierra Leone, our situation report went out last night saying 21% for last week and data not available, and I just got the data on the way here, and they actually hit 57%. So in each place we're seeing at least a doubling of their cases coming off contact lists, and that is telling us that they're getting closer and closer to being able to identify the the transmission chains and then get these things shut down. Sorry, folks, if I'm rambling a little bit more than usual, but I spent last night getting a lot of things caught up on, and then David announced me this morning we'd talk to the press this afternoon, ensuring that I was as incoherent as possible. So you know, and the reason I wanted to highlight what's happening in terms of the contact tracing and getting control of these transmission chains is that some people are going to look at that and say, oh, this is going the wrong direction, and that is completely the wrong message. And what's happening is that key indicator is coming under control, which means the investments being made in the response, the epidemiology capacity we're getting out there is making a difference. It is working. Right now, though, our funding for those 800 people out there in the field, it ends at end of February. That is how precarious the situation is right now in terms of being able to sustain this.
Thank you, Catherine.
Catherine Fiancongo-Conga here. My question, one of my questions was related to the transmission chain, because I wanted to know if these new cases were related and that you had been able to identify the origin. So apparently, yes, you did. But now I would like to know on a very practical way, how do you work when you have a case and you find out the people that are around that case? Are you contacting them? How is it possible that people part of a transmission chain are able to take a car or whatever and just leave a region? That is a very down-to-earth question, but I would like to know how it works. And my second question is related to the vaccine testing, because as far as I know, you started vaccine testing last Monday in Liberia. So are you hoping that this will help you to reach the zero case level? Thank you.
So maybe on the contact tracing, first of all, it was interesting. We had a meeting in the Red Cross, a fantastic meeting last week where the IFRC brought in all of their national committees, and we talked about a lot of the aspects of the program. And one of the things that I highlighted there was everybody knows the terminology, and very few people know how difficult it is to actually do that. We say contact tracing, and everybody thinks, okay, that's straightforward. But the reality is you have to go to the case where the case occurred, and then you have to find out, you have to identify the contacts, first of all. Who were the real contacts of that case? And it can take 2, 3, 4 hours of a very experienced, thoughtful, and discussion, interrogation with a family who are in a very rough situation to try and figure out who those contacts were. Having identified those contacts, you make a list then of them, and then you set up a team that will monitor them on a day-by-day basis, which means they will go back to the house, go back to the village, and every single day check and whether or not these people have become symptomatic. Because the goal is, as soon as they develop a fever, become sick, if you get them in isolation, they will not initiate a new chain of transmission. So that's the goal. And this is a very, very proven strategy and way to stop the disease. Now, what happens is, obviously, people may decide that, well, they were a contact, but I'm not really a contact, and maybe I will just monitor myself and go somewhere else, and they will get in a car and they will move. But the key thing is making sure that people know that they have to report and self-report if they become symptomatic, and that they know how to seek treatment, etc. It's impossible to completely prevent people from moving and from contacts. The key thing is making sure that they understand, again, to self-report and self-monitor if they are moving. Now, in some places, countries have decided to quarantine their contacts of cases. But remember, when you put a policy of quarantining contacts in place, then people aren't in a rush to admit that they've been in contact with an Ebola case. So it really is a fine balance. And the key is to get the engagement of the contacts, the engagement of the communities, and all sorts of novel things have been done. Sometimes they've given cell phones to people who had to travel to make sure they could phone them and get that to know whether or not they had actually become symptomatic, and they would phone them each day till they came back. But this is part of the end game of Ebola. It is trying to monitor those contacts. The other thing that we're trying to do is put in place systems within the countries where if someone moves from one county to another county, they can notify the other county who can pick that person up and facilitate the contact tracing. And these are all the things that we're trying to put in place now to really get to completeness of contact tracing. Some of these people who moved and caused those cases in distant places, we didn't know they were actually contacts. They weren't on a contact list. So again, it brings back that issue of finding the balance between being too heavy-handed with this and making sure everybody's on a contact list. It's a fine balance to make. In terms of the vaccine testing, it was initiated in Liberia, as you know, and really it's a two-phase study that's been initiated. The first phase is really what we call a phase 2 trial, which will, if I remember correctly, the number is about 600 people. I might have my numbers wrong, which is really looking at immunogenicity, the safety, et cetera, and then that will be extended into what we call a phase 3 trial to look at impact. The big concern right now, of course, with case numbers so low, we may get a lot of phase 2 data, but we don't get what we call clinical efficacy data because we just don't have sufficient cases. And that is the reason that we are testing the vaccines in 3 different countries, and we're using 3 different strategies for testing, hoping that one of those will give us real data on the clinical efficacy of the vaccine. Folks, if I don't answer a question properly, please ask it again.
Yes, thank you. Mr. Nabarro, you mentioned that you need $1 billion. How much do you have already? How much did you receive? And just to know, I mean, to fight Ebola successfully, it's a matter of money?
Thanks very much indeed. Firstly, when we started out with the appeals in September last year, we asked for $1 billion. It was on September the 16th. We then revised upward the estimate, and we said from September through till March, September 2014 to March 2015, the total required was $1.5 billion. We've actually had a very good income against that money, and although we haven't received the full $1.5 billion, we have received certainly more than $1 billion. What we've just done recently is to look again at the needs, and we studied how much money is needed in 2015, concentrating on the period January through till June 2015. And it came out that for that period also 1.5 billion is needed. Out of that amount needed for January to June, we have nearly $500 million in the bank, and so the gap is now 1 billion. And that is the explanation for it. If you need more precision, we have various graphs and so on we can give you. Just give us your email address, I can provide it. And I want to say, it gives me a chance to make the point that I said at the beginning. We believe that the world has been amazingly generous. We have not had to get fussed because people have promised money and they haven't given it. All we're saying is, please continue that generosity because the job is absolutely not finished. And so our request is to the people who've been generous, please go back and find a little bit more because we need more to complete the task.
Stephanie?
Sorry, Reuters, just a question and then a clarification, please. I think earlier Bruce said, gave some figures, and they were probably in last night's report about the contact tracing. The 100%, that was Liberia, was it not? And not Sierra Leone, okay. And then I wanted to ask both of you if you had an...
Just if I might clarify, Stephanie, there's two things we look at. When you look at the percent of contact tracing or monitoring, what we're looking at is how many of the contacts were seen the day before, back to the question that you'd asked. And so we track, was it 90% were tracked the day before, or 80% or 100%, and it has to hit 100. But the number I was giving you was how many of the new cases are coming off a contact list. And that really is the key one, because when you get that one to 100%, you know where your transmission chains are.
Right, okay, so that was Liberia. And then if either of you could comment on this, the ongoing drug trial of favipiravir in Guinea, please. I understand that there have been some quote-unquote encouraging results. Could you comment further, please?
Actually, at this point, there are quote-unquote no results, because it hasn't been, there's nothing publicly released on it. Yeah, the rumeur, voilà. I think, as most people are aware, this trial was being conducted in Gekenu in particular, and it has now been stopped, and I believe they had, I can't remember the number, I think it was 60 people have been enrolled. The data are being analyzed. It's very, very premature to say results are encouraging and that this would be a treatment for Ebola. I want to be really clear about that.
Yeah, Gunilla von Hall, Swedish Svenska Dagbladet. I have two questions. You talked about on schools there should be safe school openings. What do you mean by that? If you can give some examples. And the other question I had is there have been reports about the virus mutating from the Pasteur Institute. Is this, what can this lead to? Is this worrying? Thank you.
Of course, the school question is a difficult one, because for pupils to be coming to school and for their parents to be reassured that it's a safe place, we do need to have the capacity in the school for temperature checking to take place. Also, we need it to be possible for the children, when they arrive at the school, to wash their hands and to maintain other forms of basic hygiene. And so that has meant quite a lot of effort to find these infrared thermometers, the kind you've probably seen. We've all been going through them now, where somebody holds a little thing up against your head and they can take the temperature very quickly. So those are needed, have been needed in large number, plus also the capacity to have chlorine and a bucket so that the kids can wash their hands. But quite a lot of the schools in these countries don't have running water. And so it's been the process of developing the systems for that kind of hygienic behavior, plus at the same time protocols for what will you do if a child's got a fever. Because of course the commonest reason for these fevers in the children won't be Ebola, it'll be some other infection. So we need to have a way of dealing with it that is fair to the child, doesn't stigmatize, doesn't cause problems, and so on. So getting the protocols and the drills done was also important. And there was a period, certainly when I was in the region in December, when sitting with colleagues who were working on this in government, you had on the one hand people saying, let's get the schools open as quickly as possible, and on the other hand saying, but we've got to get the systems right. And that's what I meant by safe school opening. There are still some areas where they haven't quite got the systems ready, and so the opening was staggered in all three countries, and in fact has gone much faster in Liberia than in the others. So that's the answer to that. And Bruce now, if you don't mind.
Yeah, just to comment on the school opening piece. You know, everybody, I always hear it talked about as a risk. You know, the schools are being reopened, and this is a big risk, and it's going to send the wrong message, etc. In most Ebola outbreaks, the schools have been a really important part of the response, and that part gets lost as well.
Education, huh?
Yeah, there's been a huge awareness raising through the children. They've been carrying the messages back. It's been one of the most effective ways to actually carry messaging back to families, into communities, etc. And as you know, children tend to, when they understand what the issue is, they go back and they nag their parents about it. And I remember I wasn't involved with the Gulu outbreak, but Pierre and others telling me that it was a really important part and really significant part of the response. So, you know, I think we also have to look at both sides of this. There's just too much people seeing it one way, and when you get down to a certain level of transmission, you can do these things safely, reactivate your services safely. You know, on the issue of the mutations, first of all, I think everyone in this audience knows, you know, all viruses mutate. I mean, that's what they do. They change their genetic code a little bit every time they replicate. I mean, that's the reality. That's why when we genetically sequence and use the molecular tools to understand transmission chains, we can do that. Now, the same word that is used, you know, to describe that, which is a mutation, is the same word to describe, you know, the evolution of these monster viruses people ever worry about. But, you know, there's nothing, no evidence at this point that there are any mutations associated with the Ebola virus that confer on it any kind of characteristics that would complicate the response vis-a-vis its susceptibility to the response strategies we use or the way it's transmitted.
Right, just to follow up there, so the mutation, there's no signs that this will be a more contagious virus. It's not mutating in a way that it would make more contagious.
No, there's no evidence to that effect at this point. And remember, often people will look at something in a lab and say, oh, this is doing this, and then meanwhile we're dealing with 20,000 infected people whose behaviors we can see in the evolution, and it often doesn't translate into what you're seeing in a community level, and at that level definitely not.
You mean you're not trusting the lab people?
I love the lab people, they're absolutely fantastic, but it's got to be borne out in practice.
Any other question before we wrap this up? I don't see any. Would you like to say a final word?
Of course, we very much appreciate that you're here quite late in the evening to be with us. And I think on this outbreak, the partnership between yourselves as the investigative communicators and ourselves as the people who've been made responsible for advancing the response has been special, and we hope that if there's ever a moment when we can clarify or explain, you won't hesitate to be in touch with us through our colleagues, Padella particularly, and we really do want, as a continuing partnership, just to be as open as we can. And we thank you very much indeed for the time. And you've got your hands up. And if it can't be done now, we can do it bilaterally afterwards.
Maybe 30 seconds? Yes, come on. Go ahead, Gabriela.
Coming back to the money that you need, sorry. Do you need that international donors, as long as they see that you have the situation under control and this is not an international threat, do you think that they are like not interested in donate more?
I think the donor community are all the time trying to evaluate the priority that has to be given to a particular challenge, and the request for resources is always far, far greater than the cash that's available. In this situation, what I'm seeing is that the donors do understand that the only acceptable result is a complete end to transmission, and I believe that we will mobilize the resources that we're looking for. It'll take a bit of time, But I think through repeated explanation of where we're at and the challenges we face, we will be able to get the resources required. I'm not, frankly, too worried. The only thing that I'm saying is money now is worth so much more than money in a month or 2 months' time. And I think that's our anxiety, is trying to get the resources in as quickly as possible so we don't end up with interruptions. That's what's dangerous. Do you agree, Bruce?
Yeah, and you know, this crisis is different than so many other crises that we're dealing with right now, because you have to get to zero. That's reality. It started with one case, it will end with one case. We have to get to zero. And that requires a level of programmatic perfection that is so rare in terms of what we have to achieve in humanitarian and other relief efforts. You've got to be perfect to get to zero, which means it's got to be financed, you've got to have the right people in the ground, and you can't have gaps. If you have gaps, you have a flare, and then all of a sudden you have got large-scale Ebola again. And, you know, the point really we're making today is the virus is telling us loud and clear what it's going to do. And remember how it started in Guinea. You know, if you look at those graphs, it had a long lead up before it went up in Guinea. This can have a very long bumpy tail and bumpy landing. And if you look at all of the other Ebola outbreaks we've dealt with, they often run months at the end. They don't have to. They do when we haven't got the people on the ground, the money. We've learned the hard way. So, you know, the hard way to do this is what we're doing. The very, very hard way to do this is to try and do it when it's pouring rain. And that's what's going to happen in 2 months. It's going to be very, very difficult. The other thing is to remember the ecology of this virus somehow changed last year, and it emerged in this area where we hadn't seen it before, entered the human population, spread like wildfire, and started to spread. That probably hasn't changed. There's still risk of new emergencies, etc. So we have got to have that infrastructure in place. It's got to be solid to be able to get this one stopped, find the new ones, build in some resilience, and shut these things down. So the big message today is the resources aren't there to avoid that risk.
Thank you very much. Good night.